All right, guys, let's take a look at anxiety. When we're looking at anxiety, guys, anxiety is an adaptive response to stress. Ultimately, it's going to be a temporary response. That's what it should be, and that's the normal process. However, but for some individuals, anxiety will actually become a chronic problem. So when we look at this, episodic means it's going to come and go based on circumstances. Chronic is going to be long term. Anxiety could also be mild, but it can also be very severe. Anxiety could be adaptive, or it could actually be functionally impairing, where it actually impairs your body from functioning properly. Now, is it a symptom of something else going on, or is it the actual disorder that's the problem? Hey, there are some anxiety disorders, which we'll talk about in a little bit, and other times anxiety is just a symptom of another issue. Now, this is a reaction in response to a threat or even a perceived threat that potentially could cause the anxiety, and it's a feeling of worry, nervousness, or unease. This unease or nervousness is about an imminent event or something with an uncertain outcome, like you don't know exactly what's going to happen if you make this type of decision. Those are the types of things that ultimately can trigger a lot of people's anxiety. Now, anxiety can go from an individual where they have no anxiety. They could then develop mild, moderate, severe, or even panic disorder type of anxiety. This is a type of spectrum that we see here. When we look at mild or moderate anxiety, it's actually beneficial to learning, motivation, and heightened awareness of your surroundings. It actually is going to help you. If it's severe or panic, it can actually be debilitating to the individual. Now, anxiety is a product of a fight or flight response. This is due to the central nervous system, specifically the autonomic sympathetic nervous system. We also have the general adaptation syndrome, which was talked about back in the stress chapter. It's what we should normally do when we're dealing with anxiety or stress. And if you're looking at that general adaptation, remember there's the alarm stage, there's the resistance stage, and then there's the exhaustion stage. We don't want to get to that exhaustion stage if all possible. Genotype could also be a product that causes anxiety. This could have where somebody's more vulnerable to developing anxiety due to stress, or they're more resistant to anxiety. Certain brain structures and neurochemistry also could cause you to be more prone to it. Some symptoms of anxiety can be linked to certain neural circuits or even neurotransmitters. These neural circuits might be the limbic system, the thalamus, the amygdala, the hippocampus, or the hippocampus. For neurotransmitters, it could be an issue in the individual's serotonin, norepinephrine, or even dopamine levels. Another thing that can become part of this when we talk about brain structures and neurochemistry is that if there's a malfunction specifically in the amygdala, we see that can actually develop panic and phobias for the patient, and it is centered around a mishap in that particular neural circuit. Okay, so when we look at the clinical threshold when we're talking about anxiety, this is the point where we can actually observe and recognize that anxiety is present. Clinical perception is the nurse's ability to recognize anxiety-based symptoms as quickly as possible. Sometimes nurses can actually perceive them before the threshold is met by the patient, where the patient notices that they're having issues. Now, if you look here at this particular picture, you can see that anxiety and worry are here in the middle because they are linked. That's what they kind of do. But they kind of go hand in hand. Worry can cause you to have anxiety, and anxiety can cause you to have worry. We also see that it can affect other things like your muscle tension, your irritability, your sleep cycles, your concentration. It could cause you to be fatigued. We might have some arousal issues, panic attacks, phobic avoidance, where they have these phobias and they want to try to avoid it at all costs. And it could even cause some compulsions, especially like when we talk about OCD. Now, guys, chronic anxiety can affect a lot of different areas of the body as well. If chronic anxiety is present, it can actually affect the kidneys and the renal function, as well as the cardiovascular system, the endocrine system with its hormones, the gastrointestinal system. A lot of times will tell on you if you're anxious or dealing with stress improperly, the immune system, neurologic system, and also your psyche. Okay, when we talk about psychology and the psychiatric side of things, it could also affect you there. Now, this is because when we look at anxiety specifically, as well as stress or even mood that we discussed earlier, these are going to be mind and body influencing each other. They do influence each other, and the other will respond. We hope it responds in a positive way, but it does not always. All right, so let's talk about some of these potential disorders that we can end up seeing. Okay, one of the first ones we see when we look at anxiety disorders, these are characterized by irrational, debilitating fears. Okay, and there's kind of 4 groups we're going to hit on. We have panic disorder, generalized anxiety disorder, obsessive compulsive disorder, and phobias. So when we talk about panic disorder, guys, this individual is going to have acute episodes of anxiety symptoms. They'll come on unexpected and suddenly. They may reoccur, and they generate intense feelings of fear. This anticipatory side of the anxiety can actually cause panic attacks to occur. Avoidance is often used as a personal strategy to increase feelings of control and decrease their panic anxiety. Some clinical manifestations we see with panic disorders, there's some physical symptoms that come into play, like dyspnea. They may have palpitations of their heart, tachycardia, chest pain, dizziness, numbness, trembling, sweating, and even hyperventilation. On the psychological and cognitive side, they'll express this fear of dying, impending doom, losing control, derealization, and depersonalization can be seen. Some behavior symptoms is they will end up being hyperkinesis, meaning they move around a lot. They can't sit still. Pressured speech, they'll have an exaggerated startle reflex, like where normally if you just called their name, it wouldn't be a big deal, but it startles, it scares them. Attacks, when we talk about panic disorders and panic attacks, could last 5 minutes to 30 minutes. Okay, so there's a kind of wide range there, and they can be coming over and over again. Now, treatment. We can do cognitive behavior therapy. This is aimed to reduce fearful thinking and desensitize the patient to the things that may trigger panic attacks. Benzodiazepines might be used, and some antidepressants. These are to help stop the panic attacks, but they don't actually help anxiety as a whole. Beta blockers may dampen physical anxiety symptoms. So these are some potential looks at the panic disorder. So let's now look at the generalized anxiety disorder. This is where worry that's chronic and persistent, as well as causing physical anxiety symptoms. So in other words, guys, they have excessive worrying. It could be mild to intense anxiety that's caused. It's a state of constant anxiety that leads to things like dry mouth, nausea, vomiting, diarrhea, and even muscle aches. It can also cause fatigue, restlessness, muscle tension, muscle pain, and disturbed sleep. What are the clinical manifestations of generalized anxiety disorder? Well, the physical symptoms vary widely, and they include things like muscle tension, specifically like in the neck and shoulders, lightheadedness. The patient may experience sweating, palpitations, stomach distress, and chronic headaches. On the psychological side, they'll have uncontrollable worry with no areas in their life excluded. They will worry about anything and everything. Behavior symptoms include sleep disturbances and then fatigue. Medication is sometimes used for general anxiety disorders, but in reality, relaxation training and behavior therapy tend to work the best. All right, the next one we want to look at is obsessive compulsive disorder. This is persistent involuntary thoughts that provoke anxiety and involuntary anxiety management rituals. Okay, so these thoughts cause the anxiety, and then they think they need to do certain rituals to help control the anxiety. Typically, patients strive to avoid disclosing their symptoms. Lifetime OCD prevalence rates for the general population is actually little over 2%, whereas the risk in first degree relatives goes up to almost 10%. So if you have a relative, okay, a close relative that also deals with OCD, there's a higher chance that you might develop this. So clinical manifestations, we have the obsession side. These obsessions are strong, persistent, intrusive, uncontrollable thoughts. This leads to then the compulsions. The compulsions are repetitive, ritualistic acts. They perform these a lot of times with urgency, and they are typically related to the obsession that they have been thinking about. Concern about dirt and contamination might be one. They may need to do some counting. And a third group that is purely obsessional and they don't have compulsions could take place. Now, affected individuals of OCD tend to lack the ability to stop, govern, or even resist these obsessions or compulsions. Okay, we see that there are kind of some syndromes that come into play with here. Some people have to have the symmetry and order. So in other words, they're going to make sure everything is organized. If anything gets out of this organization, it causes issues for them. We also have individuals who are afraid of contamination, and they're the cleaners. We also call them the washers. And when we talk about OCD, about 25 to 50% spend hours of washing and showering because of this fear of germs and lack of cleanliness. We then have the hoarders. This is 25 to 30% of individuals with OCD, and they're hoarders. And you think, wait a minute, people that are OCD, they like clean and organization? No, not necessarily. This with the hoarders is they cannot throw anything away. If they try to, it causes issues for them. And then there's the checkers. They have the obsessions and they are going to do lots of checking. They check to see if they have done something over and over and over again. And even though they just saw it and they saw that they've done it, they'll check it again. And this is that whole idea of obsessive compulsive. We do feel there is probably a strong genetic or inheritable risk that comes along with individuals with OCD. We see treatment as a lot of times exposure therapy and response prevention. So again, exposing them to the issue, but then not allowing them to respond with their rituals. Cognitive behavior therapy used in conjunction with medication management might be beneficial. High doses of anti-anxiety, antidepressants, even atypical antipsychotics may need to be used. Okay, and so these are just some examples of how we would potentially treat OCD. The last group on here are the phobias. Phobias are actually the most common type of anxiety. They're intense and irrational fears of an object, situation, or a thing. And guys, there are over 700 known phobias. These can range from things like you're scared of heights, you're scared of pain. There's even one where individuals are scared of men. We see flying, spiders, thunder, lightning, or even storms, blood, water, physicians. They have some phobias of failure. They're afraid of failure, public speaking, being alone, crowds, certain odors, snakes, disease, ghosts, fear itself. There's a phobia of fear. Okay, that one is actually called phobophobia. Fire, food, death, being poisoned, injury. There's some people who are afraid of the number 13, strangers, and animals. And the list can go on and on and on. And like I said, phobias are the most common type of anxiety disorder. So what are some risk factors of developing some of this stuff? We see that we have an average age of onset of 11 years when we talk about anxiety. Women are 60% more likely to develop anxiety than men. We see that especially white women are going to have a higher risk. We see anxiety peaks in the middle of adulthood in the ages of 30 to 50. And there are some individual risk factors that come into play. The first is temperament, how the person responds to their environmental events, whether emotionally or behaviorally. Okay, there's 9 different temperaments that a lot of times they will assess in children that might help lead to whether they deal with anxiety. These are things like their activity levels, their distractibility, intensity, regularity, sensory threshold, approach or withdrawal, adaptability, persistence, and even their mood. Some environmental factors that could put you at higher risk is things like separation anxiety, like if you've lost somebody, there's been a death in the family, profound change in their life. We also see phobias come a lot of times from environmental factors due to parental overprotectiveness. Parental loss or separation could cause issues, as well as physical or sexual abuse. Stressful life events could also contribute. There could be a link genetically to individuals that deal with anxiety. And then when we look at the psychologic side, it's related to certain types of anxiety in the sense of on the physiologic side, there are some certain links that some individuals, when they deal with certain disorders of anxiety, they're more sensitive to certain things like CO2, or they may be more sensitive to actual fainting. Like if they see blood, they have an increased what we call vasovagal syncope response, which is just fainting due to the fact of seeing the blood. And this is causing a psychological change due to the anxiety that they're feeling. So assessment. When we look at assessment for anxiety, we're going to do a history of physical. When we do the history though, guys, it's very important to build a rapport with the patient. Sometimes they're not as apt to tell you everything going on if you haven't taken the time to build up a rapport. Each individual that you talk to, though, may not understand certain terminology. Like when you ask them, are you dealing with anxiety? They may not know what anxiety means. But you might ask them, do you worry a lot? Do you worry about certain things a lot? Okay, another one might be panic. They don't understand what panic means. Okay, so then it could be, do you find yourself shutting off where you can't shut off your mind? You're just thinking of things constantly. Okay, these are ways to potentially look at their history. Sometimes questionnaires are helpful where you would give them like a scale of 1 to 10 on how they're feeling about certain things or what kind of behavior they may end up doing. Looking at certain risk factors, their mental state, medical history, family history, and even if there's a history of trauma. Physical assessment, you're going to look at their vitals. You're going to listen to their heart and lungs. You're going to look and palpate their thyroid. You're going to do a cranial nerve assessment, and blood and urine tests a lot of times are done. The reason, guys, is you'll start to see a lot of times when patients are dealing with anxiety, they're going to end up having hypertension, high blood pressure. They'll have tachycardia where their heart is racing. They may even have issues with their breathing with tachypnea. They may sweat. Okay, and so there's a lot of things that we can assess physically with this. We also want to look at their mental status. Now, the cranial nerve exam also kind of deals a little bit with mental status because mental status and cranial nerve exams are part of neurological assessments. But we do see with the mental status, we want to check out their appearance, their attitude, their behavior as a whole, mood and affect, their speech patterns, how they're communicating with you, their thought process as well as the content of their thoughts, their perceptions, their cognition, their insights, and their judgments. So sometimes you may have to ask them certain questions to see how these might be affected. Now, signs of anxiety are going to be things like impaired concentration, distractibility, they have talkativeness, panic, and then they may have some sort of compulsive type of behavior. So for management, how do we need to manage anxiety? Well, primary is we want to reduce the risk. Okay, reducing the risk could be due through education, altering risk behaviors, decreasing exposure to certain things like traumas. Okay, we could also look at enhancing home life and resistance, mental health, focusing on well visits, strengthening family functioning and stability in the family can also help reduce panic and stress, especially in children. Secondary, we see that early detection is key. Monitoring for symptoms and functional impairment needs to be done, and this is done just even through normal checkups. When we look at some of the other sides of what's going on, we need to look at the treatable psychiatric conditions because anxiety is the most treatable. Okay, there's lots of different things out there that we could ultimately use. So when we look at drugs are not normally used alone. Drugs can be used like benzodiazepines or antidepressants could be used, but a lot of times they're going to be used in combination with therapy. So when we look at therapy, guys, there is what we call the psychoeducation. This is going to be where the patient and their support system is going to be educated about their diagnosis, their treatment, risk factors, optimal health, illness prevention, to give guidance to the patient and their support system. Another one might be cognitive behavior types of therapies. This is one that changes how one perceives and processes the sensory stimuli, okay, that's causing their anxiety. This is recognizing and neutralizing cognitive distortions and even their core beliefs of like, why are they scared of the number 13? Prolonged exposure therapy might be used. This is where we take the patient back to their index trauma. We want to idea and then alter sensory triggers. This one can be kind of difficult, especially if the trauma is very severe for the patient. Cognitive processing therapy, again, addresses the trauma, highlights their awareness, their thoughts and their feelings, and gives them skills to manage those thoughts and feelings. Mindful-based cognitive therapy is going to teach the patient how to develop the skills of non-judgmental awareness of their own thoughts and feelings. So a lot of times with anxiety is they judge how they feel and think they don't feel correctly, and so then it causes their anxiety to build even more. Another one is eye movement desensitization and reprocessing. This one is going to look at traumatic memories while they're stimulating and focusing on another sensory stimulus. The sensory stimulus could be sound, it could be hand taps, or even eye movement. Again, we're not even exactly sure how this works, but somehow it helps with the neural circuits and it will help with anxiety. We also see animal-assisted therapy. Lifestyle modifications may need to be done based on like diet or even just activity levels. And then also complementary and alternative medicine could be utilized. These would be things like supplements, vitamins. It could be like massage, acupuncture. Those types of things could also be helpful in the management of anxiety. All right, so this finishes up anxiety. If you have any questions or concerns, please let me know.